Hospitals across the Wabash Valley are fighting COVID-19. One of the tools they have at their disposal is creating a negative pressure environment. News 10 Bureau Chief Gary Bryan tells us how one local hospital got help from the community to create their own.
On the onset of the pandemic, Carl Richland Memorial Hospital began drawing up plans to deal with COVID-19. Part of those plans included creating negative pressure rooms. Negative pressure rooms keep bad air from escaping. Here's how it works. Fans and filters are installed into a room. Ductwork leads out of the room to a safe environment. Once turned on, all that air is pulled into the system and away from those it could harm. Director of Plant Services Les Harrison says the first area set up was in the emergency department.
To be able to make that first incoming area of the hospital, when we're seeing those patients suspected, that we could place them in an area to protect the rest of the population.
Another unit was set up in the Family Maternal Services Department. This was to make sure if an expecting mother had COVID-19, she could give birth in a healthy environment. In total, 4 new environments were set up, all thanks to the help of donations.
It was very important, and it was great for us to be able to have access to that donor funding to purchase these immediately.
Carl Center for Philanthropy received almost $7,000, all donated by members of the community, coming together to take on the pandemic.
We feel we're ready, and we just hope that we don't have those mass number of cases in the area, and we're, I think, as ready as we can be.
Harrison says they'll be able to continue using the system beyond the pandemic. Working from home in Vincennes, Gary Bryan, News 10.